everybody! Today we're going to be going over all the major arteries and veins of the arm. So we can go ahead and jump into it. So arteries are vessels that carry oxygenated blood from the heart away from the body, and they get pumped out to the system. And so the heart would be located down here, and here's our aorta. So we'll start here where the blood initially comes out. The aorta has three branches. So it has the right brachiocephalic trunk, depicted right here. It has the left common carotid artery, and then the left subclavian artery. The brachiocephalic trunk actually has the common carotid and the subclavian combined into one trunk. That's why it's called a brachiocephalic trunk. So we'll go off the right side just for our purposes here. And so our first branch right here to go to the arm, as the common carotid goes up the neck and to the brain and the face. So we can go down here to the subclavian artery, which is our first artery up here. And our big subclavian artery, it's very large as it's handling a lot of high pressure from the heart there. And there's a bunch of branches that branch off of the subclavian artery. The way I remember it is the mnemonic vitamin C. And so we can start off with our V is the right vertebral artery. As you can see how it branches off first right here. And that one travels through the transverse cervical foramen of the cervical spine up to the base of the brain, and start the posterior aspect of the circle of Willis to supply the brain with blood. Next we have our I from vitamin is internal thoracic artery. This artery shoots straight down into the anterior chest wall to send out a lot of arteries to the ribs and to the intercostal spaces. So that is our internal thoracic. The next one on the list is thyrocervical trunk right here, which gives off a bunch of branches as well, and including some of these branches include the suprascapular artery. You might remember suprascapular from suprascapular nerve, which innervates the supraspinatus and infraspinatus. The suprascapular artery travels very close to the nerve over the transverse ligament of the suprascapular notch to supply blood and nutrients and oxygen to the supraspinatus and infraspinatus. Also off of this trunk is the dorsal scapular artery. They're not listed here, but there's some of the branches off the thyrocervical trunk. The dorsal scapular artery, again, has the same name as the dorsal scapular nerve, innervating the levator scapulae, rhomboid major, and rhomboid minor. And similarly, the dorsal scapular artery supplies oxygen and nutrients to those three muscles as well. And then moving on down the lane, we have our last one is the C in vitamin C, is the costocervical trunk, just again supplying more nutrients to the rest of the arm. So our next big branch is the axillary artery. So once the subclavian artery comes around here and passes the first rib, it's now known as, name change, is the axillary artery. And you can see it has three parts here. 1, 2, and 3. These three parts are named after its relationship with the pec minor. The pec minor stretches right by across number 2. And the axillary artery runs underneath the pec minor, right there. And then the space before that's known as space 1, and then after the pec minor is known as space 3. And so we have more branches off of the axillary artery. The way I remember them is the mnemonic, slap the lawyer, save a patient. Our first one is the superior thoracic artery, supplying all of the big chest muscles. So we have the pec major and the pec minor getting supplied by this guy, and then a little bit in the subclavius and serratus anterior. Moving on from part 2, we have two big branches, the thoracoacromial artery right here, and this one has a lot of branches. As you can see, it has a pectoral branch, clavicular branch, acromial branch, and deltoid branch. Again, supplying a lot of the muscles around the deltoid, the acromion, and the pectoralis, major and minor. The next one, here's the lateral thoracic artery, traveling downwards to supply that lateral rib cage, especially that serratus anterior and subscapularis. Next branch out here is finally section 3, is our subscapular artery. The subscapular artery is the biggest branch off of the axillary artery right here. And as you can see, it splits again to form two important arteries, is the thoracodorsal artery, named after, again, the thoracodorsal nerve, same name, to innervate the latissimus dorsi. So this one supplies oxygen and nutrients to the latissimus dorsi. And then we have the circumflex scapular artery here, which goes behind the scapula to also help supply the infraspinatus. And then our last two here, this one's fun, I like these a lot, is the a patient at the end. So this is the anterior humeral circumflex, or anterior circumflex humeral artery, comes off first. And then right after that is the posterior circumflex humeral artery. I wanted to show you all this because I think it's really cool. And they're called circumflex because they literally wrap right around the humeral head. And so we can see them here. Here's the anterior circumflex humeral artery wrapping around the humeral head to supply the bone. and then our back here is the posterior circumflex humeral artery, and they connect. So they form a complete loop around the humeral head to keep that bone nice and supplied and make sure it has nutrients that it requires, which is really, really awesome. And those are all the branches of the axillary artery. Moving on, we continue down the main road is the brachial artery, and this is the big artery of the arm running medially to the bicep, traveling very, very close to the median nerve, eventually coming down to the cubital fossa, as you can see here as it runs underneath the bicipital aponeurosis of the bicep. And this is easily palpable, and the artery that we compress when we take blood pressure. The branches of this one, the big branch that we need to be aware of is called the profunda brachii, which branches off posteriorly to the brachial artery. And I wanted to show you all this as well. And so down here on our model, here's our brachial artery. The biggest branch off here right here is the profunda brachii, or the deep brachial artery, and that runs really close to the radial nerve. And it travels along the radial groove of the humerus, very, very close to the radial nerve, and eventually terminating with its anastomoses or connections with the elbow arteries down here. So something to be aware of. That helps to supply nutrients to the posterior aspect of the arm, like the triceps and coneus. Moving on to the brachial artery, we'll come down, and once it gets down to the cubital fossa, which is this little triangular space known as the cubital fossa, it splits into the radial and the ulnar artery, named respectively after their bones that sit underneath it. And we go to the forearm, moving down. So we can see here is our radial artery traveling alongside laterally of the body around the radial side, which is a nice palpable pulse you can feel right there at the wrist. And then it continues down to the hand, which we'll go over in a second. And then up here again we have our ulnar artery coming down, traveling along the ulna, and supplying all the muscles on this side, and the wrist down here coming down to the hand. Important branch off of the ulnar artery is called right here, is called the common interosseous artery, named after the interosseous or the IO membrane that connects the radius and the ulna together. That splits into the anterior and posterior interosseous artery right here. Anterior interosseous artery stays anterior to the IO membrane to supply the deep muscles of the anterior aspect of the forearm, such as the flexor digitorum profundus, pronator quadratus, and flexor pollicis longus. And then we come back here and we can see the posterior interosseous artery. It actually pokes through the IO membrane to travel posteriorly, and it sits right there all the way down to supply the posterior aspect of the forearm muscles. And then as we move down to the hand, we have our radial and ulnar arteries to form the two arches. So we have the superficial palmar arch and the deep palmar arch. And then those both come off the radial and ulnar, and they form two arches here. And off of the arches come the common digital arteries, and then they split to form the proper digital arteries, which aren't labeled in the picture, but those will travel along the sides of the fingers and along the lateral aspects of each finger to make sure the hand is properly supplied with oxygen and nutrients. And the good thing about having two arches is that if one gets occluded with a certain grip that you have, or in some cases if it gets blocked or something, then the hand can still get blood supply because of the two arches, because it has recurrent blood flow, not just one, which is really cool design of the hand. Moving on to the veins, I wanted to show you all a little bit of the venous structure. We'll start down at the hand because veins, as we know, they're a lot less muscular, a lot less elastic, and these vessels are responsible for bringing deoxygenated blood back to the heart. So we'll start the hand and work our way back to the heart. So it has the same thing. We can see these arches, the superficial and deep palmar arches, which are made from the ulnar vein right here. And similarly, we can follow that ulnar vein up. And similarly with the brachial artery, here's our radial vein. So the radial and the ulnar vein make those arches again, and they will come up to drain into the brachial vein, appropriately named, which actually goes up and then eventually drains into the basilic vein. And this basilic vein is very large. As you can see, it travels all the way from the top of the arm all the way down to the wrist, and is located very immediately along the arm, superficial vein, which drains into the axillary vein, which then drains into the subclavian vein, which eventually drains into the superior vena cava, into the right atrium of the heart to get the blood circulation. Now, tracking back, one important branch off the axillary vein is this large one, is the cephalic vein. You can see how it goes, and this one actually travels in that deltopectoral groove where the deltoid and the pectoralis kind of sit. So it sits on top of those and then goes down to go laterally along the entire arm, along the entire elbow, all the way down to the wrist. Massive vein. And then the last major vein that I wanted to talk about here and highlight is one branch off of the cephalic vein is this one, as the median antebrachial vein. Like focusing on this one, and you can see how it runs down from the hand all the way up here to eventually drain into the cephalic vein. Important thing to note about the median antebrachial vein, approximately right here as it travels through the cubital fossa. This is actually the vein that you can see on your arm and is where IVs are placed for drawing blood, donating blood, giving medication in the hospital, making sure your fluid and electrolyte balance are normal, and that's the vein that is most commonly punctured with IV fluids. And those are all the vessels, arteries, and veins of the entire upper extremity that are clinically relevant that I wanted to share with you all today. I hope you learned something. Thank you so much for watching. If you have any questions, please feel free to put it in the comments. I'm the PT guy, educating you on God's wonderful creations. I'll see you in the next one.